Well, now let's get to the latest on Omicron in India, and the number of Omicron patients in the country that we know of are 38, with Kerala reporting its first case. 5 fresh cases surfaced on Sunday, 1 each in Chandigarh, Andhra, Karnataka, Maharashtra and Kerala. For Andhra, Chandigarh and Kerala, these were the first cases reported there, and the World Health Organization has said the new Omicron coronavirus strain has been found in 63 countries and will surpass the Delta variant in its speed of spread. If we talk about each of the cases that have been detected, then in Kerala it was in someone who had returned from the UK. In Maharashtra, it was a 40-year-old man in Nagpur who tested positive for Omicron. He had returned from South Africa. In Andhra Pradesh, a 34-year-old returnee from Ireland who had been to Mumbai first. And in Karnataka, a 34-year-old South Africa returnee. In Chandigarh, it was a 20-year-old who had come from Italy, and he was asymptomatic and fully vaccinated with Pfizer. Now, if we talk about what the World Health Organization has said so far on the Omicron variant, they have said that this new variant of coronavirus is more transmissible than the Delta strain and reduces vaccine efficacy, but causes less severe symptoms according to the early data. Faster transmission has been noted in South Africa, where Delta is less prevalent, and in Britain, where Delta is the dominant strain. While initial reports have suggested mild disease, data was insufficient to establish the variant's clinical severity. Well, let's go across to Meher now for more. And Meher, so far the cases that we know of in the country are 38 of the Omicron variant, but it is worrying because already this variant could have been here since, it's only because we're checking people coming in from abroad from a particular date. But even before that, clearly people must have arrived here with the variant. So the need of the hour is for more aggressive testing, especially where clusters have broken out.
Yes, Kargi, so the total cases of Omicron now stand at 38. 5 cases were detected of Omicron in the last 24 hours, and 3 of these cases were from regions where Omicron has actually not been detected before. These regions are Andhra Pradesh, Chandigarh and Kerala. Now, that is a matter of concern because that means that Omicron is already spreading in India. And in Kerala, as we know, transmission is currently high. Most of it is the Delta variant. But now that there is an Omicron case there, there is the need for more attention being paid to these areas. Of course, we know that it is not as... this is what the World Health Organization has said, that it's not as severe disease as the Delta variant, but it is much more transmissible. And from what we know about the Indian health system, that even if it leads to mild disease, if transmission is very high, if lots of people get this variant and fall sick, our health systems could get overwhelmed very fast, very easily. So there is no room for complacency, although the WHO has said that it can lead to mild disease. There still needs to be concern for the people who are comorbid, people who are elderly, because they are not safe, and neither are most people. Now, there are 8 states and union territories that have detected this variant. Maharashtra is leading with 18 cases. Rajasthan has 9. All of these were from a wedding that was held in the state. Karnataka has 3, Gujarat has 3 as well. Kerala, as we said, detected its first case yesterday. Andhra Pradesh also its first yesterday. Delhi now has 2 and Chandigarh has 1. Now, these are all very far-flung areas, so the Omicron variant is already spreading in India, and there is need for caution, need for preparedness for what this can lead to.